Good day, everyone. I am Dr. Azura, a consultant medical oncologist in Beacon Hospital, and today I will talk about colorectal cancer. Colorectal cancer is the commonest cancer in the gastrointestinal tract, and it starts in the colon, which is a part of a large bowel. Beside it, which is the further end of the colon, called the rectum. Colorectal cancer is the second commonest cancer in Malaysia, and in fact is one of the top 3 world cancers. Colon cancer is also preventable, as it is already proven to reduce the risk of death and dying from colon cancer. Over the past decade, the trend and incidence of colorectal is increasing among the younger age group, which is between 20 to 49 age, and is not seen before. So it's now we are also seeing younger patients diagnosed with colorectal cancer. Many patients will ask about what are the symptoms of colorectal cancer. In reality, many patients have little symptoms or none at all, and it is especially so in early stage cancer or when they have polyps, when they have no symptoms at all. This further enhances the reason of undergoing screening colonoscopy to accurately diagnose it as an early stage. There are some symptoms of colorectal cancer that we all should be aware of. The commonest one is bleeding in the stool. The presence of blood in the stool could be bright red, or it could be altered, dark, or even not obvious. Patients could have change in the way their stools appear, with change in caliber from rounded to pencil-thin size. Patients having difficulty passing motion, change in their bowel habits, tummy pains because of obstruction, and patients sometimes can be tired because of what we call occult blood loss due to chronic bleeding. Patients with cancer of the tail end in the rectum may have a condition called tenesmus, which is really unsatisfactory bowel opening because they feel as if there's something left behind even after passing motion. Patients can also present in advanced stages, and this can have usually bowel symptoms such as decreased appetite, nausea or vomiting, and uncontrolled weight loss despite having no intentional dieting or high level of exercise. Patients can also have other symptoms outside the bowel, such as difficulty in breathing. There are many risks of developing colorectal cancer, and there are some factors that can be adjusted or altered and some are not. Factors such as increasing age or family history of colon cancer cannot be altered. However, there are many lifestyle factors that you need to be aware of and put in place in order to reduce your risk of colorectal cancer. Factors that can be altered would be changes in your diet to increase your amount of fruits and vegetables, reduce your fat, increase fiber, reducing smoking or stopping smoking even better, reducing alcohol intake, and to maintain a healthy weight to your adult life is important to reduce development of polyp, which is of course the precursor of colon cancer. You need to be aware of your own personal history of any medical history, particularly inflammatory bowel disease such as ulcerative colitis or Crohn's disease, which can predispose one to increasing risk of colon cancer. Patients with family history of colon cancer, sometimes they may be aware if there is a lot of polyps in the colon in the family, and sometimes there is also a condition where there is no history of polyps in the family, whereby there are history of many kinds of cancers such as pancreas, breast, or endometrial, where they can also be at risk of developing colon cancer. If there is a family history of colon cancer in the family, you should also consider having screening colonoscopy done, and if possible, have it done 5 to 10 years earlier than the person that was diagnosed with colon cancer in your family. There are many variety of tests to diagnose and confirm or support the diagnosis of colon cancer. The first test, your doctor will order stool examination called fecal occult blood to detect the presence of unseen blood in the stool. Many doctors will usually go on and order a scope test such as sigmoidoscopy, which is a scope that examines the tail end of the colon, or the best test would be to assess the entire length of the colon, called colonoscopy. This is an important test because it helps to remove the polyp or even perform a biopsy, which is taking a bit of the sample of the abnormal tissue found inside the colon for testing, which is a definitive test to confirm cancer. Patients would also require other tests, such as a blood test, obviously, to detect the presence of low hemoglobin or tumor markers, and also to do scans such as a CT scan or a PET-CT scan. And for patients who may have cancer of the rectum, may usually undergo a scan called the MRI of the pelvis, which help to assess the proximity of the tumor to local structures such as the bones and the nerves, and also the sphincter and soft tissue in the pelvic area. Treatment for cancers such as colon cancer is the same like any cancer. If that cancer is localized, surgery will be undertaken, and that will be a curative procedure for that patient. However, if the disease has spread or found in the adjacent lymph nodes, these patients would require or be recommended to have chemotherapy for 6 months following surgery. Most of colorectal cancer would be advised to test for a gene called RAS and other genes associated with colon cancer, which may have relevance in terms of predicting or recommending better treatments for treatment of their cancer. Patients that have disease in the rectum will also have chemoradiotherapy, and that is ideally done prior to surgery to have a better shrinkage of the tumor, therefore more successful surgical removal of the tumor. So advances in colorectal cancer now, with assessment of certain molecular characteristics of the tumor, may allow avoidance of chemotherapy, and we are now seeing the use of immunotherapy for certain types of stage 4 colon cancer with long-term control for these patients. It's crucial that you know what are your risks, and you know that colon cancer is preventable. It's crucial to make sure that you get a colonoscopy if you need one. Be aware of your symptoms, know yourself, know your family history, and even if you are over 50, screening colonoscopy is recommended for most patients. The earlier the diagnosis, the better the outcome. Led by a team of 9 resident oncologists, hematologists, surgeons, as well as allied health staff, Beacon Hospital strives to improve the quality of life for our patients at every phase of the disease, from early detection, diagnosis, treatment, palliative and supportive care. We can care for you. Your health is our priority.